Hi guys, I am Austin Wheeler. I am one of the second year Pediatric Emergency Medicine Fellows here at UAB. Thank you guys for coming to our website, considering our program, and hopefully joining us here for fellowship. So I wanted to start by kind of telling you a little bit about myself. I am originally from Waco, Texas. I went to undergrad at Texas A&M in College Station, and I did my medical school at the University of Texas at Houston. I then moved to Birmingham for my pediatric residency, and I loved it here so much that I stayed for fellowship. So wanted to tell you why I love this program so much and why I chose to stay here for fellowship. So this emergency department is a high volume level 1 trauma center. So we see everything from really sick chronic kids to kids in septic shock down to our bread and butter bronchiolitis and asthma. We certainly see lots of level 1 and level 2 traumas, and we run those in conjunction with our surgery colleagues. But certainly we get to help run those traumas, we get to help manage the airways, and we also run the code situations in our trauma bay. Along with the high volume comes lots of opportunity to educate our residents, as well as get lots of procedures and feel very comfortable doing those procedures on your own. One of the other big perks of our fellowship program is the autonomy that we get. So we start our first year with several months of orientation in which you will see patients on your own. And you will run those by the attending that you're paired with that day, and they will offer guidance about your plan or things you could do differently. And so that's a great opportunity to get more comfortable in our unit and start to learn how to manage these patients on your own. After that period, you are staffing patients on your own, and you are staffing those patients with the residents. And so you get a lot of hands-on experience, and you get a lot of opportunities to also teach the residents and teach the medical students. Along with providing a teaching environment here, you never really are alone at work managing these patients. You always have a co-fellow or a faculty member who is in the emergency department, and you can bounce those ideas, about your patient or management off of them, but also, working closely with them, you also hear about their patients and get lots of learning on other patients as well. And now to further provide that educational environment, we also have didactic lessons on Thursdays, and those are faculty and fellows, and we get formal lectures from our faculty, but also our co-fellows are presenting evidence-based medicine articles and journal articles, so we get lots of opportunities to learn here. The people at UAB in our emergency department are beyond amazing. We are a very close-knit family, and certainly we hang out outside of work as well as at work. And Birmingham is a great spot for if you have a family, or if you're single, or if you have pets. There is lots of great restaurants, lots of great places to go drink, lots of outdoor activities that you can do with your family or your pets. If I could do it all again, I certainly would still choose UAB.